Namaste and Siddhi Pranam. Welcome to your today's topic, which is Kegel practices during pregnancy. So let's dive into understanding the Kegel practices. So Kegel exercises are also known as pelvic floor exercises, and they are a set of exercises that target to strengthen the pelvic floor muscles. So the pelvic floor muscles are a group of muscles that provide support to the bladder, uterus, and the bowel. We have had a complete chapter on pelvic anatomy, and I hope you know this already, but just giving you a review of what is pelvic floor muscles. So they play a very crucial role in maintaining bladder and bowel control, and they also support the organs in the pelvis and enhance the sexual function. So Kegel exercises were developed by Dr. Arnold Kegel, who is an American gynecologist, and they have since become very widely recommended practice both for women and men. So while Kegels are beneficial for people of all ages, they are particularly important during the certain life stages such as pregnancy or postpartum recovery, as well as when the individuals age. So the primary goal of Kegel exercises is to strengthen and tone the pelvic floor muscles, and strong pelvic floor muscles help prevent and treat issues such as urinary incontinence, which is involuntary leakage of the urine, and pelvic organ prolapse, which is when the organs sag into the vaginal canal, and sexual dysfunction. So they also aid in preparing the body for childbirth and can contribute to faster postpartum recovery. So performing Kegel exercises involves contracting and relaxing pelvic floor muscles, and the exercises can be done discreetly as they do not require any special equipment or specific body position. They can be done while sitting, standing, or lying down, and making them easy to incorporate into the daily routine. So to correctly perform Kegel exercises, it's important to identify the pelvic floor muscles first. So let's look at understanding the pelvic floor during pregnancy. So the pelvic floor is a group of muscles, ligaments, and tissues that form a supportive sling at the bottom of the pelvis, and it plays a very crucial role in supporting the pelvic organ and facilitating sexual function. So during pregnancy, the pelvic floor undergoes several changes and experiences increased pressure, which can have implications for a woman's health. An increased weight and pressure can be there because as the pregnancy progresses, the growing uterus puts additional weight and pressure on the pelvic floor muscles, and this can lead to stretching and weakening of the muscles and potentially causing pelvic floor dysfunction. And there are hormonal changes also that affects this area. So hormones like relaxin that are released to prepare the body for the childbirth. What relaxing does is it helps loosen the ligaments and tissues, including those in the pelvic floor, so which allows the passage of the baby during the delivery. However, this increased flexibility can also contribute to instability and potential pelvic floor issues. So the other changes that occurs in the anatomy during the pregnancy is, other than the hormonal as well as the other things that are impacting the pelvic floor muscles, is first is urinary incontinence. So the added pressure on the bladder can lead to stress on the uterus, on the urinary bladder basically, and through this what can happen that urine can leak during activities like sneezing, coughing, or exercising. And this weakened pelvic floor muscles may struggle to provide adequate support to the bladder, and that might result in this type of incontinence. And then hemorrhoids is another issue that can happen if the muscles are not strong enough. So the increased pressure in the pelvic area can also contribute to development or worsening of hemorrhoids, which are swollen blood vessels in the rectal area, and hemorrhoids can cause discomfort, itching, and pain. Now, next is pelvic organ prolapse. So in some cases, the weakening of the pelvic floor muscles during pregnancy can lead to pelvic floor or pelvic organ prolapse, and this occurs when the pelvic organs such as bladder, uterus, or rectum descend and press against the vaginal walls. And the symptoms may include feeling of heaviness or pressure in the pelvic area, urinary or bowel dysfunction, and discomfort during the intercourse. So to maintain the pelvic floor health during pregnancy, some of the recommendation is, first of all, is Kegel exercises, of course. So regularly performing Kegel exercises can strengthen the pelvic floor muscles. And to do a Kegel exercise, one needs to contract and hold the muscles which you would use to stop urinating for a few seconds and then release. And repeat this several times throughout the day. And then to maintain healthy pelvic floor muscles, we also need to maintain a healthy weight. So excessive weight gain during pregnancy can put additional strain on the pelvic floor, and so it's really important to aim for a healthy weight gain recommended by the doctors. And then practice to be in a good posture. So we need to maintain proper posture that can elevate pressure on the pelvic floor to avoid slouching, and try to engage your core muscles while sitting or standing. And then stay active. So we need to engage in regular physical activity. This can help improve overall muscle tone. That includes the muscles of the pelvic floor. And then if there are still some issues, we need to consult with our healthcare provider to determine that we are doing safe and appropriate exercises during the pregnancy. Then we need to avoid constipation. So straining during the bowel movement, if we are straining too much, that can further strain the pelvic floor muscles. So we need to stay hydrated and consume fiber-rich diet such that we do not get constipated. So we need to avoid being constipated as much as possible. So let's look at importance of Kegel exercises during pregnancy. So Kegel exercises are highly important because one, they strengthen the pelvic floor muscles. So the pelvic floor muscles do provide all the support that our pelvic organ needs, which is urinary bladder, uterus, and the bowel. And during pregnancy, these muscles do experience a lot of strain and pressure. So when we regularly perform Kegel exercises, it helps us strengthen and tone those pelvic floor muscles and enhance their ability to support the growing baby as well as the pelvic organs. And then we need to prevent the urinary incontinence. So pregnancy hormones and additional weight of the baby can weaken the pelvic floor muscles, which leads to urinary incontinence. And Kegel exercises does target those specific muscles involved in the bladder control. So when what they do is they improve the strength of those muscles and reduce the risk of urinary incontinence. Also it helps minimize the risk of urinary incontinence during the postpartum period as well. So let's look at another benefit. So preparation for labor and childbirth is another great benefit of Kegel exercises. So strong pelvic floor muscles are essential during labor and delivery, and they provide and help to push the baby through the baby birth canal. So when we do regular Kegel exercises, they improve the tone and flexibility of these muscles, making them more effective during the pushing stage of labor. And they are great support in postpartum recovery also. So the pelvic floor exercises, pelvic floor muscles undergoes a lot of stretching and strain during the childbirth, and by strengthening and the pelvic floor muscles with Kegel exercises, what we can really do is promote faster recovery and improve overall pelvic floor function after delivery. So this can help reduce the risk of issues like urinary incontinence, pelvic organ prolapse, and sexual discomfort or sexual dysfunction during the postpartum period. And it also help us enhance our sexual well-being. So strong pelvic floor muscles can contribute to improved sexual function and satisfaction. And by increasing blood flow to the pelvic region and enhancing muscle tone, Kegel exercises can help maintain vaginal tightness and improve sensations during sexual activity, and also aid in achieving orgasm. Now let's look at the correct techniques of doing Kegel exercises. So first step is to identify the pelvic floor muscles, and to locate the correct muscles, we need to imagine that we are trying to stop our urine in the midstream. And the way we would actually stop the urine in the midstream, those are the exact muscles we are looking for. So the muscles we use to do this are called pelvic floor muscles. However, it's important not to regularly practice Kegels while urinating, as this can disrupt the normal bladder emptying. So next is we need to find a comfortable position. So we can perform Kegel exercises in various positions like sitting, lying down, or standing, and we can choose a position that feels most comfortable. And then the next stage would be to contract the pelvic floor muscles finally. So then we can squeeze and lift the pelvic floor muscles upward, and then focus on the sensation of pulling them upward and inward. And then we can imagine that as we are lifting the muscles from the inside. But we need to avoid tensing the buttocks, abdomen, or thighs at any point in time while performing this. And the next stage is we need to hold the contraction. So once you have squeezed the pelvic floor muscles, we need to hold the contraction for about 5 to 10 seconds, or as long as one is comfortable squeezing them and managing it without straining or feeling discomfort. The moment you feel too strained or discomfort, it's best to stop it immediately. Then relax and release is the next stage. So we need to gently release the contraction and allow the pelvic floor muscles to fully relax. And then we need to rest for a few seconds before repeating the exercise. Then repeat and progress. So we need to start a few repetitions each day and gradually increase the duration of the contraction and the number of repetitions over time. So we need to aim for 3 sets of 10 seconds contraction and 3 times a day. And then we need to remember to breathe normally during these exercises and avoid holding breath at any point in time. And then we also need to ensure that we are not overexerting or straining excessively at any point in time. It's very important to find the right balance and effort and relaxation in this. And then consistency is the key. So we need to make Kegel exercises a regular part of our daily routine to experience the benefits during pregnancy. And then let's look at modifying Kegel practices during pregnancy. So first is we need to focus on relaxation. So relaxation exercises for the pelvic floor muscles can prepare the muscles for labor and delivery. So we can incorporate periods of gentle relaxation and release between Kegel contractions. So we can also modify the intensity for some women. So as the pregnancy will progress, some mothers may need to modify the intensity of the Kegel exercises. So instead of aiming for maximum contraction, we can focus on gentle and controlled contractions that do not strain or cause any discomfort. And it's also at the end of the day important to listen to the body and avoid over-exertion at any point in time. So it will be crucial that you communicate this to the mothers practicing this. And then we need to adjust the position. So as the pregnancy will advance, we need to find comfortable position for Kegel exercises that might become more challenging. So we can try performing Kegels while sitting on a stability ball or lying on our side, or even standing with support if it feels more comfortable. And we can find a position that allows us to engage our pelvic muscles effectively without putting any strain on the back or abdomen. Then incorporating pelvic tilts. So pelvic tilts can be beneficial during pregnancy as they engage and strengthen the pelvic floor muscles while also helping elevate any lower back pain. So to perform pelvic tilts, we need to stand with our back against the wall and tuck our pelvis under and press our lower back gently into the wall. And then we hold for a few seconds before releasing. And then this can also be done the pelvic. We can actually also do pelvic tilts while on our hands and knees. So like being in the plank position or something like that. And then we can also use props for support. So you can consider using props like pillows or cushions to support the body and maintain proper alignment during Kegel exercises. And this can help relieve any strain from the lower back as well as the pelvis. Then we can modify the frequency and the duration. So depending on the comfort level of the mother or any specific recommendation from the doctor about their health condition, we may need to modify the frequency and duration of the Kegel exercises. So you might really find that it's really helpful to perform shorter sessions of Kegel throughout the day instead of one longer session or sustained contraction. So let's look at trimester-wise consideration. So first trimester. So during the first trimester, we should focus on gentle contraction and pelvic tilt exercises against the wall. And in the second trimester, we can adjust the position for comfort, like side lying or sitting or sitting on gym ball, and as we approach the third trimester, we can perform Kegel exercises in a supported reclining or seated position to strengthen the pelvic floor. And these tailored exercises can help ensure healthy pregnancy and prepare the body for the childbirth. And let's look at integrating Kegel exercises to our daily life. So first we can set reminders, and Kegel exercises can be easily forgotten amidst of a busy schedule. So we really need to set reminders on our phone or use an app to prompt throughout the day. And this will help the mothers to take those few moments to perform the Kegel. And then we can also link them to our existing habits. So we can associate Kegel exercises with an existing habit or routine. For example, you can do Kegel while brushing your teeth, or during the morning or evening skincare routine, or while waiting for the morning coffee brew. Or by connecting them to established habits, we can actually, then it will become easier to remember and integrate the Kegels to our daily life. Then multitasking. So Kegel exercises can be done discreetly while performing other activities like sitting at your desk, watching TV, or sitting in the traffic. Since Kegel do not require any equipment or specific body position, we can perform them anywhere throughout the day. So then we can combine them with breathing exercises. So combining Kegel exercises with deep breathing exercises would be like inhaling deeply, and then exhale fully, and then contract the muscles while you have exhaled, and then repeat the cycle. Inhale deeply, exhale, inhale and exhale. So inhaling and contracting, and exhaling and contracting, or other way around. And this not only will help strengthen the pelvic floor muscle, but will also promote relaxation and stress relief. So we can also build them into exercise routines. So if we engage if the mothers engage in other forms of exercise during pregnancy, like prenatal yoga or swimming, or etc. They can incorporate Kegel exercises as part of those routines. For example, during a yoga class, they can perform Kegel during specific poses or transitions. And they can also partner up. So if they have a partner who is supportive, then they can involve them into the Kegel exercise routine and they can remind them to perform it, or they can both do it together. And this can lead to a more bonding experience and provide mutual encouragement as well. And then we need to maintain consistency. So consistency is the key when it comes to Kegel exercises. So one needs to really aim to perform them at least 3 times a day, and gradually increasing the duration and number of repetitions that are required by or recommended by the healthcare provider. So making them a daily habit will really help reap the benefits and maintain the pelvic floor. I hope this was helpful and contributed to your understanding, and you will continue to contribute to many, many lives through this, all the knowledge that you have received from this. And may you inspire them to have consistent Kegel practice to support their pelvic floor health. With that, thank you and